Hi everybody, Dr. Brett, Advanced Pain Centers. We're back from that circuit breaker, which is great news. We're all happy to be back in the clinic and serving and taking care of people. But today I want to talk to you about 5 things that we can do when we have a slip disc. So 5 things we can do when we have a slip disc. I'll be right back with that. All right, so 5 things that we can do when we have a slip disc problem or a disc prolapse. This is inspired by a good friend of mine in Calgary who just called me up, just emailed me about a disc problem that just happened, and he's just panicked about it. So this is for you, Darren. This is for you, buddy. Okay, so 5 things. There are a number of key things that can apply to pretty much anybody. And remember, there's no one size fits all for all of these. So maybe one of these works for a friend of yours when they had this problem, but it might not work for you. So even if someone has a lot of advice for you on what worked for them for their disc problem, keep in mind you're different, and of course your bodies are different. So now let's get to it. Number 5. So the first thing that is an option for people, and usually the first option, is rest and do nothing. So in essence, doing nothing and rest is perfect for someone who is young, who has a disc problem, or somebody who's this is the first time they've had a disc problem. Whether that just means you're icing, heating, but in essence just laying down and letting the inflammation come down. Again, this is usually for minor problems or people that might not necessarily be in a big hurry. So again, the pain scale might not be too high. Number 4, medication. And I'm specifically talking about pills in this particular example. So taking over-the-counter medication or even a prescription medication, which is, of course, in essence meant to block the pain. Now, this may be appropriate for someone in a lot of pain. However, and even someone who's not in a lot of pain. However, the key point with this is that you are still resting, or you're still not going back full-time to your normal activities. This is important because if you take a pain pill, it's literally sort of blocking the signal, and it potentially could lead to even bigger problems when you don't feel like you're pushing it to the next stage of tear, for example, but you have no idea, you don't feel it, the swelling may be increasing, but you don't feel it because of that pain pill. So that's number 4. Number 3, a jab. So an injection. There are a few different types of injections. The most common is intramuscular jab, usually in the bum, and this is really not a lot different than taking a pain medication. There may be a combination of muscle relaxant or anti-inflammatory in the injection as well, but it's going to usually be quicker acting because it's getting directly into the bloodstream. Again, you don't want to take a jab, feel better, and then just go right into your normal activities. Again, potential risk for further damage. And so that's one type of jab. The other type of jab, the other big one, number 2, is the epidural. So you don't have to be pregnant or female to have an epidural as well. This is directly into the spinal cord area, and it essentially just blocks out the nerve there, where it's usually a steroid, so it's an anti-inflammatory agent that takes that swelling directly away from that particular nerve root where the disc could be bulging out. It needs to be hit like a bullseye, and usually there's some sort of imaging that goes along with it, so it's guided. It can work really well. Results can happen in a day to even up to a week if they hit exactly the right spot. And keep in mind, again, if the disc is degenerated, it doesn't necessarily solve the issue, but it can be a good thing to do if, again, the pain is the pain scale is really high and you need some temporary relief for that particular area. You never want to do more than a few times in a year. You don't want to risk potential damage to the bone or joint. Due to that decrease of swelling, it also decreases the size of some of those very small vessels. Okay, number 2, surgical procedure. So there's, of course, a few different types of surgical procedure based on what kind of problem you have and how serious it is and how old you are and all kinds of different things. For more information on that, I've got a couple other videos that talk directly about surgical procedures. Please look at those for more information on it, but it is an option for disc problems. And there are a few cases where even as a chiropractic doctor, it may be appropriate to do. And number 1, this is the area that we focus on a lot at Advanced Pain Centers, which is non-surgical decompression. This is by using a special table and specific protocols that are designed to release pressure on the nerve. And this pressure actually sucks the disc back inside and helps it's like a sponge-like reaction of fluid exchange to help that usually dehydrated, degenerated disc have some sort of recovery. Now, it's not going to fully recover in most cases, depending on how much degeneration is there, but stabilization and a true solving of the compression problem, again, long-term is the goal here. Now, we get upwards of 95% success rate on this for specific disc problems. Even the Mayo Clinic did a study on this, and they showed 88.9% effectiveness for relief of neck and lower back disc-related issues. So there you have it. 5 different ways to take care of a slipped disc and disc issues. Any questions about any of that, please leave a comment. Please subscribe, and thank you very much. Again, Dr. Brett, Advanced Pain Centers.